We began our conversation with talking about how complex this issue is. If it was simple, we would have solved it already. And I think it's when we say complex, it's kind of a code word for it's going to need all hands on deck approach. Every one of us has a role to play, but it's very important that we understand the complexities, but also the challenges that come in. So, to be simply and frank about this, I think it's going to be important that we have policies and legislation that look at making critical investments in social determinants of health that influence maternal health outcomes like housing and transportation and nutrition. But then it doesn't end there. We have to also think about how do we improve maternal health outcomes and promote equity and implicit bias trainings and ensure that racism gets to begin to become rooted out of the system of healthcare, where maternal infant health could be used as a model example for other areas of healthcare to root out. After National Academy of Sciences mentioned racism as an important part of a problem in healthcare system back in 2002. But then it doesn't end there. We also have to look at and protect our veterans. We also have to look at the perinatal workforce that we talked about. We have to look at the data and solutions to address and to develop comprehensive real-time solutions from a data aspect and adhere to technology, including broadband. But it doesn't end there. We also have to look at the mental health condition and substance use disorders during the time of pregnancy, pre and post. We also have to look at the entire continuum of pregnancy as well as the postpartum aspect and coverage and access for that. And it still doesn't end there because there are incarcerated moms and to-be moms that we must look at. We also have to look at making sure that the high quality of maternity care and continuity of insurance coverage is provided, not just for the infant after birth, but also for the mother for at least 12 months after the birth of the baby. And then we have to think about also how does this relate back to the levels of exposure to climate change related risks for moms and babies. We also have to look at the importance of maternal vaccinations in order to help protect the health and safety of moms and babies. So if you start to look at it, it's not one thing that we look at. It's a compendium of all of these long time neglected issues that we have to bring into comprehensive piece as a solution. And I think that's what Omnibus Act really looks at, is putting all of those best practices, important need of the time, need of the hour together, because the end result is about saving lives.